Welcome to the Pediatric Advanced Life Support chapter on respiratory distress and failure in children. Respiratory failure and distress may be life-threatening to children and may even cause death, which means that immediate care is critical to saving a child's life. Important PALS components include prompt recognition and management of respiratory distress and failure in infants and children. Respiratory distress is defined by increased breathing rate and effort, which is observed in changes in airway or breathing sounds, skin color, and mental status. When this condition worsens, it can lead to respiratory failure, which involves inadequate oxygenation, called hypoxemia, or inadequate ventilation, known as hypercarbia, or both. And this situation can quickly lead to cardiac arrest. Respiratory failure occurs when the respiratory system fails to oxygenate or eliminate carbon dioxide properly. Keep in mind, oxygen consumption in infants is 6 to 8 milliliters per kilogram per minute, while in adults, it's 4 milliliters per kilogram per minute. A blood oxygen level of less than 94% indicates hypoxemia. Tissue hypoxia can also cause hypoxemia, and decreased oxyhemoglobin saturation in the blood can be determined with pulse oximetry. The following are common signs to look for to tell if a child is experiencing respiratory distress. Increased breathing rate, known as tachypnea. If a child is breathing faster than usual, it is best to provide treatment immediately. An infant's breath rate is usually 30 to 60 breaths per minute. A toddler's 24 to 40, a preschooler's 22 to 34, and a child aged 6 to 12 has a rate of 18 to 30 breaths per minute. Pale or bluish skin color or late cyanosis. Lack of oxidation and increased carbon in the blood makes it possible for blue or purple coloring to appear around the lips, eyes, hands, and feet, as well as the nail beds. Early tachycardia, which is a rapid heart rate. Late bradypnea, which is a slow breathing rate, and late bradycardia, which is a slow heart rate. Altered mental status, such as a mood change, agitation, anxiousness, or fatigue. Observe if the child is suddenly fussy, lethargic, agitated, or anxious, or exhibits abnormal behavior. Nasal flaring. Check if the nostrils widen when the child breathes in. Clammy skin. The child's skin or head may be cool and sweaty. Chest retractions. When taking a breath, the child's chest may appear to sink below the neck or under the breastbone. If you find any of these symptoms in a child, you should continue with the primary and secondary assessment and procedures to determine what type of distress the child is experiencing and treat the condition as immediately as possible. Increased partial pressure of carbon dioxide in the blood indicates inadequate alveolar ventilation, known as hypercarbia. Hypercarbia is severe but hard to detect. The signs of hypercarbia are tachypnea, altered mental status, agitation, anxiety, and nasal flaring. This was a section of our Pediatric Advanced Life Support course on respiratory distress and failure in children. Please proceed to the next section of this course and review the corresponding videos.